7 Partition Archive. Given the critical situation South Asia is facing right now with the COVID-19 crisis, we are adding some new programming to our channel to answer your questions about the crisis itself. Today's topic will be nutrition and lifestyle disorders and the preventive approach. My name is Vikrant and I'm volunteering to bring you this episode. Joining me will be Dr. Subhashree Ray. Dr. Ray is an expert in clinical and public health nutrition with 8 years of experience. She's authored 19 research papers and she's an international speaker, certified diabetic educator from the International Diabetes Federation, columnist for reputed Indian press media like The Print, Free Press Journal, Business Insider, and The Hindu. Um, we'd like to have Dr. Ray on screen. Hello, Dr. Ray. Good morning. Thank you so much for being here.
Thank you. Good morning. Good morning, Vikrant. Very happy to be here.
Brilliant. Doctor, something that I'd like to start off with is vaccine hesitancies, because in order to make sure that there isn't a third wave, or at least to curb it, right? People need to get vaccinated, but there is some hesitancy amongst the masses. Now, for you, from your standpoint as a nutritionist who understands what's going in, what it's doing to our bodies, could you explain the vaccine to us in layman's terms and how it impacts us?
Right. Being a person who also researches and studies public health, I would like to add that vaccine is nothing new. It's not like that COVID-19 vaccine is the first time which we are seeing in in our scientific society. So this hesitancy when it comes to COVID-19, I have little bit of a query in my mind that why this hesitancy is happening, because we have taken vaccines for typhoid, we have taken so many vaccines. Usually we have tetanus, BCG, these are all there. Now there are a couple of reasons why this hesitancy is happening, because some people think that maybe the vaccine has developed in a very short period of time, so they don't know if the efficacy is good or not. But I would like to assure people that all the vaccination have gone through or going through phase 3 trial, and they are being approved by authentic authority who has assessed the result and has made sure that the vaccine is safer to take. Vaccines are built with inactive virus particle or dead virus particle, or maybe some genetic part of that virus. So when it goes inside our body recognizes that as a foreign particle, and the immune system starts working against it. So that is a memory. It's been created, or the antibody created against that particular virus. For that, next time when that virus or that pathogen attacks us, so our body already knows that something similar they have experienced with, and the antibody is already there to uh, you know uh, counter that particular infection. So it's of extreme importance that we are taking vaccination, because no vaccination will give you 1000% assurance that you will never have the disease, because infection is absolutely impossible to cancel out totally. But vaccination ensures that you will not land up in ICU, you will not have a severe outcome from the disease, right? So there is a difference between being positive and being severely sick. So if I'm positive, meaning okay, I have the virus and I'm just having asymptomatic, I'm asymptomatic or some mild symptom maybe, but there will not be any severe outcome from the
Mm,
disease.
mm, mm.
So it's immensely important that we take the vaccine, and also we complete two dosages, or the dosages which are mentioned, which are particular for each vaccination, each vaccine. So some has one dosage, some two dosages. So if a vaccine gives you two dosages, so you have to complete that. And also one last thing, that after taking the vaccination, fully vaccination, when you're fully vaccinated, it takes at least 15 days time, like 2 weeks time, to develop the antibody. Within that
Okay.
period, anybody can contract the virus. But like I said, that if you are not vaccinated and you have contracted the virus, so your chances of severity is way higher than a person who has taken the dosages.
Okay.
That is there.
Okay. So, just one last clarification. It goes into my body reacts as if because it's an intruder, makes a memory on how to fight the intruder. Next time the intruder
Right.
comes, we don't lose as badly or we don't lose at all. That is the basic
Exactly.
idea, right?
Exactly.
And it
Exactly.
doesn't, there is no microchip in it, there's no poison in it, it's not killing me in any way, right?
No, I mean that is what I'm also very surprised because COVID-19 vaccine is not the vaccine which has been developed for the first time. So before this, we have multiple vaccines and we are taking vaccines. I mean,
Mhm.
but this hesitancy never came when it comes to the other vaccines, right? So why COVID-19? I mean, this is also simply an infectious disease which needs to be countered with COVID appropriate behavior and vaccination. If any population, at least 70% of total population in any country needs to be vaccinated for a herd immunity to be there. That is, when a community has maximum percentage of people who are vaccinated, so your
Yeah,
chances of getting back getting the infection is rare, right?
I
Yeah,
understand. I understand.
yeah,
Okay, let's move to the nutrition bit of it now. Okay,
right,
I'd like to take two different demographics. Let's say kids and the elderly. All right.
right.
During COVID, let's say I'm a child who's got COVID, or I'm an elderly person above the age of 60 who's got COVID. While I'm going through the infection, what kind of foods and fluids should I consume? Versus once I've improved, what should I consume?
Right. So that is a very good question. Now, according to the epidemiological data, what we have seen so far, there are children. I mean, children are not being very highly infected, or even if they are infected, they are positive. They are not so much severely affected because of their age. They have better immunity. So, in case of children who are having COVID positive, for them, it's important that we are not giving them any fast food because the kids nowadays they are more prone to take fast foods. They're too much into Maggie and etc. And although they are having the infection, they don't understand that okay, these are the things which we need to be avoided. So in kids, I mean, it's extremely important that we
Yeah.
avoid chips and yeah, chips and
High
particularly
sodium food
Maggie.
and stuff like
Ah,
that, right?
yeah, right.
Okay.
High
Okay.
sodium and high sugar for the elderly because they are at more vulnerable stage or status to develop the infection, to get into the severity. So we have to make sure that the elderly are getting enough protein in their diet because they need more protein, more calcium, because already
Mm-hmm.
they are vulnerable towards osteoporosis, that is loss of bone because of the age. So calcium containing diet, protein, iron containing food, for example, spinach and dates, these are important. Also,
Right.
there has to be easily digestible food for their digestive system also because elderly, see, with age, our capacity for each organ like that get decreases, right? So these are the couple of points
Okay.
I wanted to make here. Yeah.
May I ask you something? So
Yeah,
for the
sure.
iron bit, you said spinach and beetroot, I think, right?
Beetroot is one. Dates, I said.
Dates,
Dates,
dates, right? For
lean
protein,
meat. Yeah.
so fish, chicken, right? What about
Egg.
vegetarians?
For vegetarians, they will be taking all the pulses, beans in
Pulses.
particular, lentil, green
Okay,
leafy vegetable, which is dark, like kale and
okay,
spinach. Yeah,
okay. So
all
dal,
these, all these.
simple dal and
Dal,
stuff,
huh?
right? So not too much tadka, just boiled dal will be good.
Yeah, I mean, that is something which is there in India, right? I mean, we are very happy to put spices and oil to our
Yes,
diet.
yes. But while we're going
Yeah,
through it and after it, we should, prohibit ourselves from too much of
yeah,
it,
we
right?
should change it.
Okay,
of course.
okay. Actually, my next
Right.
question is going to be about indulgence, but you already answered indulgence in a very clear form. So I'm going to move to the one after that. I personally cannot eat a meal if I don't have
Mm-hmm.
something to munch on, if it's not crunchy. Okay.
Mm-hmm.
So, and it's mostly carbs. It's so bad. I know, uh, especially during an infection. Could you tell us a little bit more about carbs and what we can have and what we shouldn't have during the infection and post infection?
Right. So, carbohydrates, are in news. I mean, people around, everyone wants to go and try low carbohydrate diet, which is a very, very good development. However, during the infection, we need energy, right? Instant energy to support the medication, to support the recovery. So while a person is taking medication and at even home isolated, I'm not talking about the ICU patients, because that nutrition, or hospitalized patient nutrition, because that is totally medical nutrition therapy, which is being um, calculated by a hospital registered dietitian. I'm talking about home isolated mild patients, or moderate patients who are home isolated. For them, easy available source of energy has to be there. So, for example, simple plain dal rice. Okay. So we will not give that person brown rice at that point, because it might be difficult to digest that. Plain white rice would do, but here moderation is the key. Everywhere, actually, moderation is the key. Now, a bowl of dal and rice, khichdi, right? Dal soup, correct? Which is thick dal sometimes. So when a person is in infection, so that time we will be giving that person plain dal soup and not thick dal. But when he is recovering, that is after, when he starts to become, little bit better slowly, so then the consistency of the diet will not be so thin. So we will try to give that person better, uh, like more thick dal, and big pulses like rajma, kidney beans, lima beans, right? All the beans. But in during infection, the person has to provide it some soup and some like particularly which is easily digestible, and not like it has to be blended. The food has to be blended, that so that the person doesn't need to digest a lot or put a lot of effort. The body should not be putting a lot of effort to digest it, because during the infection, all the organs are being infected or affected by the virus, right? Here, the fluids are very important. Now, even during and after, like when the person is recovering, both the time, ginger basil tea is a very good choice, right? With a few drops of honey. Uh, Turmeric milk is a good idea. Coconut water, because it contains lot of electrolytes, which helps you with the dehydration process. Also, there can be simple fruit juices prepared at home, but home. Do not add sugar to that. Smoothies are very good idea. For example, spinach plus banana, little bit of apple, and some dry fruits. We can top it up with some flax seeds and chia seeds, right? So you can make some smoothie, which is majorly liquid based diet. Correct?
Can
So
I
that.
add, sorry, can
Hmm.
I add like good to sweeten my stuff, or is it not a good idea?
Okay. Yeah, so this is a matter of discussion, because many people think that jaggery or honey are better option than sugar. Let me tell you that it's not. It's not, because when it comes to glycemic index, when it comes to glycemic index, you know that the index which determines that how further, how much a food can actually spike your blood sugar, that is known
Right.
as glycemic index and glycemic load.
Okay.
So, in terms of glycemic index and glycemic load, all three, sugar and honey and jaggery, are same. So for a person who is trying to avoid sugar, or for a person who is living with diabetes, for them these three are all same. So we need to add no more than 2 teaspoon in a day, entire day. So that can be sugar also, that can be jaggery also, that can be honey also. Only
Okay.
good thing about jaggery is that it contains iron
Yes.
additionally. Like for
Yeah.
example, white sugar is just sugar. It's empty calorie. It has no other nutrition. Only sugar, only empty calorie. But on the other hand, jaggery has iron to offer. So
Okay.
that is a good
Okay.
thing. That is a good thing.
Okay. The redeeming factor.
Yeah.
Okay.
Yeah.
Well noted
Yeah.
on that. So I would assume, given what you have told us, that an easily digestible diet while I'm fighting COVID, avoid things like processed sugar, even jaggery and honey. Keep it simple, keep the consistency thin. As you improve, thicker and more complex proteins and carbohydrates can be introduced into your diet to fight, right?
Right.
That's great.
Absolutely.
With fluids, you said coconut water, and I think you said something with turmeric as well.
Basil tea, turmeric
Basil tea.
milk,
Basil
basil
tea.
and ginger tea.
Tea,
Those are very good
turmeric
for
milk.
dry cough also. Very good for
Okay,
dry cough.
okay,
Yeah.
okay, and
Yeah.
okay. Great. So now we have fluids. We know what to eat. Uh, Talk to me about dairy, doctor. Can I consume dairy after? Because I know it's tough to digest, but I also have heard that it's good for me. I've also heard it's bad for me. So after COVID, can I consume dairy to, strengthen myself?
So, yes, Vikrant, you can have because milk, any milk, right? Any milk for that matter, nutrition. I'm talking from the nutrition science perspective. Milk is a complete food because it contains all the essential amino acids. It contains lot of minerals, for example, your calcium, your magnesium, and zinc. So, milk is important, right?
Okay.
But here, what happens if a person is having lactose intolerance? That is,
Hmm.
you cannot digest milk, right? Because this is an inborn error of metabolism where you are born with that kind of error where a person is having a particular the enzyme that is needed to digest lactose, it's not there in your body, so
Right.
you will not be able to digest dairy, particularly milk. But when it gets converted into curd and buttermilk because it's fermented, so sometimes it's easier to digest that, right? So we can have milk before and after, but if you have allergy or intolerance to lactose in particular, so I would say that you avoid dairy, you switch on to almond milk, you switch on to soybean milk, coconut
Okay.
milk. There are a lot of other options. Yeah. But
Okay.
it's important that we take calcium in our body, right? So, what are the sources? Definitely, there are vegetables which are there, but when it comes to milk, even there are other nutrients also that we need to include in our daily diet, right? So, that is what I want to say. Even yesterday, I just came through an article, a new study with 2 million people, 2 million. So that's a huge data, right?
Right.
So there was no link found between cholesterol and milk consumption. 2 million people.
Okay.
So milk is totally safe from nutritional point of view. But if you talk about vegan, vegetarian, all these food choices, which is very personal, then vegan usually they avoid dairy,
Right.
right?
Right.
Yeah, yeah.
Okay. Great. So how about your
My
weight?
sorry, Vikrant, my screen is frozen. Are you able to see me?
Yes, you're frozen, doctor.
So
But
what shall
I
I do? I'll just switch on and off my camera. Let's see that.
yes.
But it's still
Okay.
frozen.
It's still frozen. Not to
Okay.
worry. Not to worry.
Yeah.
We can still hear you, and your words are
Okay.
super important to us. So if you don't mind, shall we continue?
Yeah, yeah, please, let's go ahead.
Okay. Great. The screen will hopefully fix itself.
Yeah, yeah.
Oh, there.
Oh.
Perfect. There we go. So I'd like to know. weight management is something that's important, right? And it's something that's gaining popularity as the months pass, actually. Since I was born
Right,
versus now, the amount of importance people give to weight management is just paramount, right? It's changed
right.
so much. But I have heard that COVID really impacts your lungs, your stamina, the amount people can exercise. Please tell us about weight management post COVID and when can we start to exercise?
Right. So, now there are two things which happen usually if a person is infected with COVID-19. Some people lose weight drastically and some people gain. So mostly the gain part we are seeing, which is more common because of prolonged lockdown. Correct? So I see almost 70% of my patients who are coming with at least 5 to 8 kgs weight gain, who are home isolated or maybe treated with mild COVID. First of all, the exercise part, you need to start when you feel comfortable. So we should not go overboard right after the recovery. We should not
Right.
start very intense exercise just when we have recovered because that might not support our system. So we need to take it slow. We need to make sure that we are going slow, and first, we need to start maybe with 10 to 15 minutes of walking, because I hear from people that when they try to walk, right, even they feel like breathlessness, the lethargy, and they don't have that uh, energy to actually continue the walking. So first 10 minutes, 10 to 15 minutes, they have to start walking, normal walking, and then slowly and gradually, when they feel comfortable, they can start with stretching. Then they can start with regular, simple home based exercises. And then when they are totally recovered, then they can go for more intense exercises. This is exercise. But it has to start, right? So the diet and physical activity has to go hand in hand to manage the extra weight gain that happened during the treatment, right? Or the infection.
Okay.
So
Okay.
yes. Yeah, we
Okay.
have to do that, because otherwise what happens during the recovery particularly, there are more food and lesser movement, and weight gain is an issue. And why we need to counter weight gain all the time? Because in COVID, we have seen that 50%, I mean, people who were obese, they had 50% more risk of developing the disease than the people who were not. 50%
Severity.
more risk. Yeah. No,
Severity
no,
wise.
contracting the virus.
Oh.
Because
Oh, okay.
you
That
see, that is what, because obesity is a metabolic disorder, and when you are obese, right, so your immunity is already compromised with in obesity and diabetes also. So these people are more vulnerable. This is even guidance by CDC. So CDC has done a research and they found that people who had obesity, they had 50% greater risk of contracting the virus.
I see. I see.
Yeah,
That's okay. I had no idea about that. I
yeah,
I knew weight gain isn't good for you and it impacts your immune system, but 50%, that's a massive rate. So we must
yeah,
take care of
yeah.
our health. And as you said, once you're comfortable after recovery, start with walks, stretching. You start to feel more comfortable, especially with your diet and the energy levels that we discussed earlier. Make your workouts a little more hardcore, phase by phase, and you'll be back into shape in no time, right? That's
Right.
keeps you mentally
Absolutely.
balanced as well. I thank you so much for that. Um, I want to talk about something that's going about, at least especially the last few weeks, black fungus, right?
Yeah.
It's apparently steroid related. And from a nutritionist's point of view, could you tell us a bit more? How to avoid it is what our audience and even I really want to know. Like, what do I do?
Right. Black fungus is mucormycosis. So we
Right.
call it mucormycosis, right? which is a very old disease. And it's not like that, it's very common. Like it came to our notice during the time of COVID-19. But mucormycosis is an old disease, right? So it's a fungal infection, and it's very rare, however. But the chances of succumbing to death from mucormycosis is almost 50%. So people really don't survive. Yeah, because it affects your, nose, your ear, and your brain. So it's very bad disease. So it totally. So even operation, but not if you're diagnosed early. Then definitely there won't be such complications. But most of the time, people don't understand these signs. During COVID-19 second wave, and actually after COVID-19 second wave in India, we are seeing a lot of cases of mucormycosis, because and doctors are actually still debating on what could be the reason, right? So some physicians are saying that it's not the first time that we are using steroids. Last year also we used steroids, but last year did not happen, something like that. Somebody is saying that no, it can be due to the industrial oxygen or the hygiene that we could not maintain in the hospitals. But last week, Friday, last week, I wrote a column for the Print India, and we discussed mucormycosis and diabetes, right? So these,
Right.
like that is something, yeah, we discussed in that article. What happened? I mean, in that article, when I was researching, so even now that the new researches are coming from India, right? We are seeing that more than 90%, somewhere 75% people were already living with uncontrolled diabetes. So, and uncontrolled diabetes is one of the most important significant risk factor for mucormycosis. I will tell you why. Because mucor, actually the fungus that thrives in an environment where sugar is there, or because they need nutrition, right? So the moment your body or your bloodstream has a lot of sugar, a lot of glucose, it's the breeding ground for the mucor. So people who were already living with uncontrolled diabetes, they are the most vulnerable. But the debate goes on. So doctors are saying no. In first wave also people had diabetes, so why not this time? So I'm not getting that. I'm just trying to say that diabetes is an epidemic that is going on since last 10 or 20 years, and more than that in India, right? And now it's ruining even diabetes. Excuse me. Along with obesity, diabetes is another risk factor for COVID-19, and now for mucormycosis.
Right.
So right. So and as the evidence is coming, in front of us, we are seeing that a, a bit bigger percentage of people are actually uncontrolled, already living with uncontrolled diabetes. Even sometimes they did not even knew that they had diabetes. So what happened? Already a person had sugar, and then maybe the steroids were being used, so the sugar even went up higher, the level. And due to COVID-19, the immunity also got worsened further. So a person who is living with diabetes has weaker immune system. Also, he develops COVID-19. The prevalence of COVID-19 in diabetic population is higher. So is the mucormycosis. So if you go back, Vikrant, so you see that one disease or two diseases, for example, obesity as a culprit, and obesity associated diabetes, right? So these are the two metabolic syndrome or diseases that's been ruining our society for decades. So I believe that these are the real problem. Today, COVID-19 is there. Tomorrow, COVID-19 will go, and then another infection will come, right? It might be. We don't know, right? I mean, we did not know that a pandemic of this scale is coming to us. it might happen. So what can we do from our end? We can't, prevent uh, uh, an infectious disease if we are not at better health. So it's important that we get a revolution on wellness, and we actually try to treat these metabolic syndromes, which are the real pandemic, which is ruining the society. That is what I wanted to add.
Okay, so this is so good. It's so important because we've had virologists, we've had cardiac surgeons, orthopedics, mental health experts come and speak to us. Okay. Everyone has their viewpoint similar to yours, of course, right? You're all doctors, you all understand diseases way better than we do. But I think you tie everything up in a knot and give it to us as a, here is a wholesome package. Be proactive. You can't control your environment, you can control yourself. So be proactive. Consume the right food for yourself so your body is best prepared to fight. Against what we do not know,
Absolutely.
as we said. Against what we do not
Yeah,
know. But be ready, right? Have good eating habits, have good sleeping patterns, have good fluid intake. That's so good.
yeah,
Thank you so much. Thank you so much, doctor. I have just one last question for you. All right.
yeah.
Um, could you please tell me how to manage taste and smell post COVID? Because it's a big thing. Some people get it like 2 days after, some after a month, some after 3 months, right? The
Okay.
taste and smell. So how is there any way to manage it, or do we just have to wait?
We have to wait. I mean, this is, something which is a very common pattern in long COVID, like after COVID complication. So really, nutrition or any other, I mean, even medication for that instance cannot really help getting your taste and smell back. So it's only thing we can do to wait and continue the recovery. That is, particularly uh, eating healthy, or getting your, like, once in a day steaming, or maybe gargling, or maybe continuing the multivitamins, right? Because this is still the gray area of research. I mean, even doctors are not able to tell you that why this is happening for so long. I don't know if some physician has discussed here earlier, but I
Right.
really did not come across, any literature yet that is saying that, okay, this is the reason that this is happening. So I would say that, yeah, it's painful that when your taste and smell is gone for so long. Many people
Yeah.
came and told me that, doctor, what to eat? I said, see, diet and this thing doesn't have any direct connection. So we have to wait, and we have to continue the recovery procedure without uh, compromising on any bit of it. So that is what I wanted to add to
Okay.
this, right? But I had to tell one last thing,
Yeah.
if you permit me.
Please.
Okay, so I wanted to talk a little bit about immunity,
Right.
because since last year, right, so I'm seeing people are popping in vitamin C tablet, vitamin D tablet, immunity boosters, Chyawanprash, all these things. I mean, whatever is available in the market. And the market also have come up with so many immunity boosters. Everything you see is immunity booster. Even Maggie also immunity booster.
Yeah, 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 yeah.
Okay, so yeah, that's so funny because uh, okay, so I wanted to tell that immunity boosting is nothing magical. It cannot be happened overnight, and definitely cannot be happened by taking one single food or supplementation. If you think that I'm taking amla from today and tomorrow I will be Superman, so that's not possible. Even if, yeah, because a lot of other things matter. So immunity is a collective procedure that involves a holistic eating. That is, you're eating your vegetables, your fruits, your whole grains. So it's a total eating plus physical activity, like you said. I mean, plus sleep, plus de-stress, right? So all these things collectively ensure that you are having a better immunity profile. Now, somebody in the morning taking Chyawanprash and entire day his diet is all about junk and oil, so he cannot expect immunity, better immunity profile, right? So it's a collective process, and people need to understand this. Second point I wanted to say that please start reading nutrition label. Please start reading nutrition label before you buy something. Why? Now, 3 days back, there was a report, internal presentation basically of Nestle, which is so common, right? Which is Nestle. So their report suggested that 60% of Nestle's product don't meet minimum criteria to be called as healthy.
Oh yeah, I saw that.
Yeah, yeah, yes. So, and those products, Vikrant, including baby foods, Maggie, all sort of Maggies, and sauce, Maggie sauce, right? Bourbon, they have like so many products, right, in India. So, this is what it is. So, I would say that let's reject processed and ultra processed food. We
Right,
don't want 5 minutes Maggie, right? So let's cook
right,
your food. Let's cook, right? So
right.
let's eat wholesome, and let's not grab something which does not have any nutritional value per se, right? So this is what I wanted to add. 2 points from my end.
Understood, doctor. Really, I do. uh, you reinforce the fact that our inner workings are like soldiers preparing for an unexpected enemy, and we cannot know
Right,
what the enemy is, but we can be prepared and we can strengthen these soldiers via different methods: the food, the fluid, the
right,
stress we take,
right.
the sleeping pattern. All these things collectively form that strength which is known as immunity, and that's how we fight this, right?
Correct.
That, and of course for the current one, get vaccinated. So
Yeah.
thank you so much, thank you so much for all your views, for your expert opinion. Your words are gold. Thank you, I really appreciate it. Okay, for all our viewers, if you hear anything that's repetitive, it's not to bore you, it's so that the point gets grilled into your mind from all these experts who give us their time, believe what they say because they've studied it for years and they know better than we do. If you want to know more, we will be hosting more sessions over the week at 9 a.m. India time. Follow us on Facebook and subscribe on YouTube to catch all our episodes. Thank you very much. Be safe.